Bonjour, good day. I want to start off by talking about what's going on across Canada and in Ontario. We're seeing the Premier of Ontario, Doug Ford, obsessed with fighting with the federal government, and then Justin Trudeau, the Prime Minister, fighting back, when really the focus has to be on getting people the help they need. Of course, we need to be better at ensuring that the borders are secure and that no new variants are entering the country, but we know the most important thing right now, the most important thing, based on all the expert evidence, is that people are getting sick at work and that paid sick leave would save lives. So we continue to put pressure on the federal government, Justin Trudeau, to improve the paid sick leave program. It needs to be better, more flexible, cover entire salary for a worker, the day's work, make sure that it is flexible and easy to access. These things would save lives. That's what we want to see. And we want to know that every step possible, every resource possible is being used to get people vaccinated. We know people need to get vaccinated and people need to be safe so they don't go into work sick. These are two concrete things we can do right now. That's where the focus should be. Donc, ce n'est pas utile d'avoir des États contre les provinces et du gouvernement fédéral. Comme on a vu avec Doug Ford et Justin Trudeau, on a besoin des gouvernements qui travaillent ensemble pour aider les gens. À ce moment, ce qui est clair, oui, on doit avoir une meilleure protection frontalière pour s'assurer que les nouveaux variants n'arrivent pas au Canada. Mais ce qui est clair avec toute la preuve qu'on a, c'est le fait qu'on doit protéger les travailleurs et travailleuses. Que la plus grande menace de propagation de la COVID-19, c'est dans le milieu de travail. Donc, on doit améliorer l'accès au congé des maladies payées. Ça, c'est primordial. Donc, on va continuer de mettre la pression sur le gouvernement libéral d'améliorer le programme qui existe. On a un programme fédéral. C'était les néo-démocrates qui ont réussi à établir ce programme, mais on doit l'améliorer pour s'assurer que personne n'aille au travail malade, ni rester chez eux sans avoir de paix. Donc ça, c'est essentiel. Et on va continuer de mettre la pression pour livrer l'aide. On doit vacciner toute la population et ça, c'est aussi la priorité. Donc, au lieu d'avoir des attaques comme ça, on a besoin de travailler ensemble et d'aider les gens qui sont maintenant dans une situation de crise et c'est urgent et on a peur. Donc, on doit les aider. Merci. Avec ça, je suis prêt pour vos questions. With that, I'm ready for your questions.
Thank you. We will now proceed to questions. We will start with questions on the phone. We will ask journalists to ask one question and one follow-up. Merci. Nous allons maintenant prendre des questions. Nous allons commencer aux questions sur le téléphone. Nous demandons aux journalistes de poser une question et une question de suivi. Opérateur?
Thank you, merci. Please press star one at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Et la première question est de Catherine Lévesque, la presse canadienne. La parole est à vous.
Oui, bonjour, M. Singh.
Bonjour.
J'aimerais savoir si vous êtes d'accord avec la déclaration du maire de Calgary qui, en entrevue en fin de semaine, a dit que les gens qui protestent contre les vaccins sont en fait des nationalistes blancs. Est-ce que c'est votre avis aussi?
Les gens qui ne suivent pas les conseils des experts en matière de santé publique sont en menace aux santé. Ça, c'est clair. Et ce sont des gens qui ne s'occupent pas de leurs voisins, d'aider les gens autour d'eux. Et ce sont des gens qui doivent reconnaître qu'on fait face à une pandémie et une pandémie qui nous frappe tous. Et on doit prendre toutes les mesures possibles pour prévenir la propagation de ce virus. Donc, on doit travailler ensemble et les gens qui rejettent le conseil sont des gens qui, effectivement, créent un danger pour les autres. Et ça, ce n'est pas la bonne chose à faire. Ils ont demandé anglais pour cette réponse.
Oui, OK, très bien.
So I can say very clearly that the people who are not wearing masks, who aren't following public health public health expert advice, are putting other people in danger. They're not thinking about their neighbors, the people around them, and they are risking an increased spread of COVID-19, which is going to make things worse. And so I would say to folks, we are in this pandemic. where we have to take care of one another. We've got to look out for one another. And it is important to follow public health guidelines so that we can reduce the spread and so we can keep each other safe. And I would encourage everyone to do that. And those who aren't doing it, I would remind you, you are putting your friends, your neighbors, the people in your communities at risk. And it's the wrong thing to do. Et puis, votre suivi?
Oui, mon suivi, ben, vous n'avez pas tout à fait répondu à la question. En fait, je me demandais, on a vu quand même là, que les manifestations contre le masque, contre les vaccins, attiraient des gens, disons, qui votent pour Maxime Bernier, des gens comme Derek Sloan, des gens, bref, qui, en général, là, peuvent être associés à certains mouvements d'extrême droite. Donc, je me demandais, je vais peut-être vous donner une autre occasion de nous dire là, si vous croyez qu'il y a effectivement un lien entre ces personnes qui protestent contre les mesures sanitaires et les vaccins et les mouvements comme Proud Boys et ces mouvements-là. Merci.
Oh, d'accord. Donc, je pense qu'il y a un lien entre les extrêmes droits et les gens qui ne s'occupent pas des autres, qui ne s'occupent pas de la sécurité des gens autour de nous et ils ne s'occupent pas des sécurités de leurs voisins. Donc, il y a un lien des gens qui sont d'extrême droit, qui ne comprend pas la connexion entre tous les êtres humains. Donc, je crois que oui, il y a une connexion comme ça d'extrême droit et c'est un problème. C'est un problème parce que ça menace les autres gens, ça menace toute la société et c'est la mauvaise chose à faire.
Merci.
Oui, en anglais avec la dernière réponse. Yes, I do think that there is an connection with people who aren't wearing a mask or who aren't following public health guidance and the extreme right. And the idea that folks in the extreme right don't care about people around them, aren't concerned about the safety and well-being of people, generally their neighbors and the people in the community, and to brazenly not follow public health guidelines puts people at risk. And that is something that we've seen with extreme right-wing ideology, putting people at risk, not being concerned about the safety of others, not being concerned about the welfare of others. There is a connection, certainly.
Thank you. Next question.
Thank you, merci. La prochaine question est de Boris Proux, Le Devoir. La parole est à vous.
Bonjour, M. Singh.
Bonjour.
Au sujet du projet de loi C10, qui est en comité en ce moment du patrimoine, il semble que les conservateurs multiplient les très longues questions pour faire perdre du temps pour l'adoption de ce projet de loi-là. J'aimerais savoir si le NPD considère que c'est pas si grave si C10 soit pas adopté avant le mois de juin et peut-être tombe avec les prochaines élections.
Je veux souligner ici qu'on a 2 ans dans notre mandat. On a été élu en 2019 et on a 4 ans. Donc, si le gouvernement libéral veut vraiment s'assurer que les entreprises internationales comme Netflix ne sont pas exemptées des lois canadiennes et qu'on a un terrain égal où les entreprises locales et domestiques ont les mêmes opportunités comme les entreprises internationales qui ont créé un terrain égal. C'est un gouvernement libéral de gérer leurs dossiers. On a 4 ans dans notre mandat. Donc, s'il veut le faire, il peut le faire. Donc, je pense que 2 choses. Premièrement, ils ont complètement échoué leur responsabilité de gérer ces dossiers en créant des confusions avec le droit de s'exprimer. Et ils ont fait ça. Le gouvernement libéral a créé cette inquiétude et ils ont aussi mal géré tous ces dossiers avec le timing parce que ils ont décidé de proposer ces projets de loi dans ce temps. Et s'ils veulent le faire dans une bonne manière, on a beaucoup de temps de le faire, mais c'est eux qui ont vraiment échoué leur responsabilité.
En suivi.
Merci. Ça répond à ma question. J'ai pas de suivi.
Et dernière question au téléphone avant qu'on va à la salle.
Merci. La dernière question est de Hélène Bozzetti, les coop de l'information. La parole est à vous. Oui, bonjour, Monsieur Singh.
Bonjour.
J'aimerais vous entendre sur cette idée là, d'une preuve vaccinale. Je ne parle pas du passeport pour rentrer ou sortir du pays, mais bien de cette idée là, qu'on doive présenter une preuve qu'on est vacciné, par exemple, pour avoir accès à des cinémas, des terrasses, des restaurants. Seriez-vous d'accord avec ça? Et si oui, comment vous verriez ça? Ça se prendrait quelle forme? Et sinon, pourquoi? Merci.
Merci pour la question. Je pense avec cette idée, c'est quelque chose qu'on doit évaluer avec les conseils des experts en matière de santé publique et je suis ouvert aux discussions. Pour moi, le but, c'est comment on peut protéger la population. Donc, ça, c'est mon but et je suis ouvert aux conseils pour arriver à cette but. Effectivement, je sais à ce moment, la priorité doit être la vaccination parce qu'à ce moment, on n'est pas arrivé à un niveau de vaccination où on peut penser de c'est quoi la prochaine étape. La première étape maintenant, c'est la vaccination. Et à ce moment, ma priorité, c'est de mettre tous les efforts possibles au niveau fédéral pour aider les provinces et territoires pour arriver à un niveau de vaccination. Ça, c'est la priorité à ce moment.
Je comprends que c'est la priorité, mais la discussion a lieu en ce moment parce que l'été approche, les terrasses, on a envie de les ouvrir. Est-ce que philosophiquement, vous voyez des dangers à ça? Je pense par exemple au fait que lorsque vous étiez encore avocat, vous avez beaucoup combattu le carding par la police. Est-ce que vous verriez d'un bon œil qu'on doive comme ça décliner notre identité, notre carnet de santé à des entrepreneurs, des propriétaires de restaurants, de spectacles? Est-ce que vous êtes à l'aise avec ça?
Je pense que vous avez bien soulevé les inquiétudes avec cette approche. Et ça, c'est pourquoi on doit toujours avoir un équilibre avec les étapes qu'on prend, les droits et les droits des personnes, et aussi le but de protéger la population. Donc, il y a un équilibre. Et pour moi, à ce moment, on n'est pas là. On doit premièrement s'assurer que toute la population est vaccinée. Et puis, on peut évaluer toutes les approches possibles pour protéger la population, regardant ou gardant en tête les droits des personnes et comment on peut les protéger aussi.
Thank you. We will now take questions in the
Morning, Mr. Singh. Stephanie Taylor with the Canadian Press.
Good morning.
You've criticized the Liberal government for its relationship to oil and gas, for the Trans Mountain expansion, yet you say that Line 5 is vital. So I'm wondering, which is it when it comes to pipelines? Like, how do you reconcile the opposition to one but support for the other?
Certainly. The Line 5 is a replacement of an existing, and I've opposed the expansion. So Trans Mountain was an expansion. And really, I'm focused on what we can do to create jobs. And we know that right now, resource sector workers in Alberta are hard hit. And so we're proposing solutions to get people jobs right now, not in a distant future, not in a precarious and unpredictable way, but something concrete right now. So we've talked about putting money towards remediating abandoned oil wells as a way to create jobs right now for those workers. There is an urgency right now. People don't have jobs, and projects that are counting on future potential of expansion and future potential for sales without having a market that shows that is something that's really vital or viable or not. Given the direction that the global markets are headed in, given where we are as a world where we want to fight the climate crisis and reduce emissions, and that some of the largest auto manufacturers, for example, have committed to ending the production of fossil fuel combustion vehicles, we've got to make decisions that protect resource workers and create jobs now. And that's why I've taken a position with Trans Mountain and existing projects or existing vital resources that are important for transportation right now, and making sure that they're up to date is a very different approach.
Most recently, we heard from Ms. Telford testify at the Defense Committee about what she knew about Vance and sexual misconduct in the Canadian military. Louise Arbour has been tapped to do a review. Where does the NDP think this issue goes next? Does the government have anything else to answer for? Does there need to be another witness, or what would you like to see kind of happen as the next step?
I really appreciate the question, because what the Liberals have done is, first of all, Justice Arbour is phenomenal and will do phenomenal work, but it is a distraction of the Liberal government to launch another inquiry when they have yet to actually put in place the recommendations of the first inquiry in 2015. And the key recommendation was identified that there needs to be an independent process for raising concerns of sexual assault or sexual harassment or sexual misconduct. There needs to be an independent process. So to date, 6 years later, with 6 years of being in government, Justin Trudeau hasn't done that key recommendation. So what confidence does that give women in the Canadian forces? What confidence does that give women, period, that there's going to be any concrete steps taken to actually fix the problem when they've completely ignored the recommendation? And so what will another inquiry do when they've done nothing to actually put in place the inquiry? It would be very different if they actually moved on that recommendation, put it in place, and it didn't work. And they're saying, okay, we tried, it didn't work, now we need to do a further review. That would be an entirely different situation, not the situation we're in. The Liberal government has completely failed women. And the reality is, women have been told very clearly by this government through their actions that if they raise a complaint, if it makes it to the highest office of this land, nothing happens. That's the message right now. That has to change. And it's not going to change with another inquiry. It's not going to change with the Conservatives just attacking Trudeau for the sake of attacking him. It's going to change if the recommendations made by a justice who evaluated this problem is put in place. And that's what we're calling for. There's no need to continue to spin wheels and to just do things to hide the problem. What we need to do is fix the problem by following that key recommendation.
Hi, Mr. Singh. David Thurton, CBC News. I'm just wondering if you could expand on the comments that you made a bit earlier about the link or the relationship that you're seeing with the far right and the anti-lockdown, the anti-COVID-19, whatever you want to call it, protests. What tells you that this is closely aligned with the far right?
Well, just the participants and the type of people that are being drawn to it are people that are also affiliated with the far right. And an extreme right, that kind of ideology is connected with not really caring about the people around you. It's a selfishness where personal interest takes over from a community protection and interest. And we're seeing, that is a trend with the extreme right, not caring about people around you, not wanting to invest in social programs, not wanting to invest in things that support all of us as a community. And the idea of not following public health guidelines and not wanting to do their part to stop the spread of an infection is very much in line with this extreme right-wing ideology of not caring about people, not supporting the people around you. And it is dangerous and it's hurtful. And it's why it's got to be called out as wrong and remind people that in doing this, they're putting people at risk. They're putting their own neighbors and family members at risk. And hopefully if we appeal to common human decency, that we want to care for each other and support each other, that following the advice of experts and scientists and medical experts is the right thing to do, and it'll help keep us safe.
Now, I'm curious whether you think these gatherings, these protests represent a real concern to our security as a society. Do you think that there needs to be any further action by any law enforcement authorities to address the situation? Or is this just something, I think most Canadians are going about their lives just kind of ignoring it and not paying it too much mind? Do you think we need to pay it more mind?
I'll break it down in terms of the extreme right. Yes, we have to pay that a lot of attention. And I think we've seen historically that the extreme right has been ignored as a real threat to Canadians, and the radicalization that happens from things like white supremacy, those white supremacist groups have been ignored, and that has been at the peril of Canadians. And so we recently were able to put some pressure to get, for example, the Proud Boys named a terrorist organization, but we want to see dismantling of those groups, and those groups exist. And they promote hatred, they promote division, and they've been ignored by security forces for a long time. So that's a problem, and that should not be ignored as a problem. It should be given the resources required to help keep Canadians safe and acknowledge that the threat of white supremacy, the threat of extreme right-wing groups is the real and urgent threat to Canadian safety. So that's important. And when it comes to people, the frustration that people feel about what we're going through, I think is a real frustration, and it's understandable. And so we've got to provide real steps forward, like where we're going, how long this is going to take, what we need to do to get to a place where we're safe again, how many people need to get vaccinated, how can we get to that level of vaccination. So I think the more we can help people by providing the path, letting people know this is where we need to get, and once we get here, we'll be in a position to be able to reopen and things will be safer. I think that'll help with the general frustration, and with the specific folks that are not following public health guidelines because they just reject it. I think Canadians, by and large, believe in public health and believe in taking care of each other. So I think I'm confident in Canadians' desire to take care of each other and follow those guidelines so that we can keep each other safe.
Opératrice, on a-t-il d'autres questions au téléphone?
There are no further questions with this at this time. Nous n'avons plus de questions pour le moment. I would now like to turn the meeting back over to you, Jordan.
We have another question in the room.
Going off of what you were talking about the Proud Boys designation, do you think that, as it appears that these anti-mask, anti-lockdown protests and organizers that seem to just, in some cases, deny that the pandemic is as serious as it is, or simply are opposed to some public health measures, do you think that the public safety agency or the federal government needs to look at a designation for those groups or a way for national security to perhaps deal with them in a more aggressive way than they are now, just given that they continue to happen across the country as we're in such a kind of deadly third wave?
Pursuing any extreme right-wing groups that are radicalizing people or that are putting Canadian safety at risk, and any white supremacist groups, I think that should happen all the time. That's an important risk to Canadians, and that we have to consider it as serious as it is, and it has been ignored for too long. So that is something that we should do. Extreme right-wing groups, white supremacist groups that are taking advantage of opportunities to radicalize people, to create division and hatred, those groups are a real threat, and they should absolutely be pursued. When it comes to following public health guidance, I think the solution to people's frustration is providing more information, providing it in a clear way, letting people know where we're headed, how we're going to get there, how we can get safe again. The more we can explain it, the more we can talk about it in a way that connects with what people are going through, is going to help people understand how important it is to follow these guidelines.